My name is Matthias König and I lead the Systems Medicine of the Liver Research Group at the Humboldt-Universität of Berlin. Today I will present data and workflows to ensure the reproducibility of digital twins in pharmacokinetics. A central application area of my research is the digital twin in pharmacokinetics. That is the question, how are drugs absorbed, distributed, metabolized and excreted in the human body? Key question in this context is, why do drugs work better in some people, while in others they are less effective or cause side effects? The goal is to use simulation-based predictions to contribute to a more personalized and safer medication strategy. Today I want to demonstrate the example of Glimepiride, first how patients' specific factors can be integrated with these digital twins, and second, how we can ensure the reproducibility of these results. We have a look at Glimepiride, a medication used to treat type 2 diabetes, which affects over 500 million people worldwide. Glimepiride stimulates insulin release from pancreatic beta cells, leading to increased glucose uptake in insulin-sensitive tissues and a reduction in blood glucose levels. We developed a detailed physiological-based pharmacokinetic model of Glimepiride. At the whole body level, we model the systemic circulation of Glimepiride in its two main metabolites, M1 and M2. In the intestine, we stimulate absorption of Glimepiride and fecal excretion of its metabolites. In the liver, Glimepiride is metabolized via CYP2C9, first to M1 and then to M2. And lastly, in the kidney, we model the renal excretion of M1 and M2. We applied the digital twin of Glimepiride to study key factors affecting pharmacokinetics: the dose dependency, renal impairment, liver cirrhosis, body weight dependency, genetic variants, and simulated virtual patient populations. If you want to know more, please look at the publication. So how can we ensure the reproducibility of such models? A crucial factor for the reproducibility and interoperability of digital twins is standardizations of their data, their models, as well as the processes, formats, and interfaces. Only through standardized structures can models be made transparent, shareable, reusable, whether in research, clinical practice, or within the scope of collaborations. A key building block in the development of reproducible digital twins is the integration of heterogeneous data. To supply our pharmacokinetic models with high-quality data, we developed PKDB, an open, structured database for pharmacokinetic time courses and parameters. PKDB contains data on a wide range of drugs and test substances. The data are standardized and FAIR compliant, enabling comparative analysis and development of computational models. As part of the combined initiative, we actively contribute to the development of open standards for modeling. These include, for example, SBML for the structured representation of computational models, SED-ML for the specification of simulations, SBGN for standardized visualizations, PEtab for conducting and documenting parameter estimation, and OMEX metadata for documenting all models and data. These standards form the foundation for reproducible research, modular modeling, and cross-software interoperability. Around the core standards, we build workflows for reproducibility called EXSIMO, Executable Simulation Model. The idea: combine model, data, and code with an execution environment so analysis can be run automatically. Core elements are models, data, and code for the computational analysis, automated tests to verify correctness, and automation layer for continuous execution and validation. Within the executable simulation model, we integrate version control, annotations, unit handling, CI/CD, and reporting of the results. In addition, we demonstrated reproducibility through an independent review by the Physiome journal, which confirmed that the entire analysis could be rerun successfully. A second independent review is currently in progress with the BioModels team. If you'd like to explore and interact with the model, visit glimepiride.de, offering an interactive web application of the digital twin, or run the analysis yourself via the GitHub repository. I want to thank and acknowledge my funding, and thank you for your attention.